going on. Tachycardia, bradycardia, limb weakness. I lost control of my bladder. I had this severe, that pins and needles moved from the one arm through my chest over to the other arm. And then it moved from my head all the way down to my toes. And then it just turned into this nightmarish electrical surge over and over through my body all the time. It was so bad that I couldn't eat, I couldn't sleep. The only thing I could do was remind myself to breathe. And from then on, it was just kind of like this, I mean, not to be dramatic, but it was just unrelenting torture. And it's still there to this day. All those symptoms are still there, other than the sensitivity to light and sound are gone now. Everything else is still there. I've just figured out how to manage the symptoms to bring the severity down enough so I can think, I can eat, I can have conversations. So
you've got this constant sensation all over the surface of your body all the time.
Yeah, it's actually, it feels like it's inside. It moves with my heartbeat. So it moves in and out from my heart all the time. It's the most foreign and unnatural sensation, you know, that I've ever experienced in my life. And it's just insane that I am plagued with it every moment of every day for the rest of my life. Yeah, it's not fun. And the other people that I know that have been injured in a similar way from AstraZeneca, I feel their pain, you know, I know exactly what that's like, and I wouldn't wish it on my worst enemy.
So this is actually a constant pain. It's not just the discomfort, it's actually painful.
Yeah. It's painful. It's a prickling, stinging, pulling sensation. And it feels like it's teeny tiny nails moving in my veins, comes from the heart, moves out. And I can feel every single beat that my heart beats because of this moving in and out. It was in my head at the beginning, in my brain, and it was so bad that my eyes would vibrate like this and I couldn't see hardly anything. It was bad. So that's gone too. But it's still, you know, everywhere else in my body.
I mean, I'm just stunned. I mean, let's go back to the first week or two that you had this. How did you sleep? How did you eat? How did you do anything?
I didn't. I mean, I've got to be totally honest with you. I mean, it almost put me 6 feet under, and that's not an exaggeration. I had a plan. I had everything, you know, set up because all I wanted was relief. It wasn't that I wanted to be done. It was just I needed a break, and there was no break that would ever come. So I just needed to be done. And so, yeah, I had a plan. And the only reason I'm alive, to be totally honest, is because of my supportive husband. And he recognized the signs right away. And he didn't leave me alone for even 5 minutes for months while this was going on. And it's not like I was pacing around, you know, like telling people I was going to do it or whatever. But because of his training, he knew the signs and what to watch for. And as soon as he saw it, he contacted a therapist and was like, what do I do? And so when he would go to the store or if he needed to go into work, he had someone come in and sit with me in the dark. So
you just felt you had to be out of this constant.
Yeah, I just needed an escape, you know, and it really breaks my heart because I didn't talk about it at all for a long time, right? Because it's embarrassing, right? Because nobody wants to feel like they are that weak, that they can be brought to their knees, you know, to the point where,
no,
you know what I mean?
Anyone can.
Yeah,
You know,
and it's
the level of suffering is terrifying, and
yeah. But what finally got me to open up was a really good friend of mine who's dealing with near identical symptoms from Pfizer. She ended her life, and that was in May of 2021. And that was
what sort of reception did you get from the doctors you reported this to?
Well, they all wanted to know what the drug company had to say about it because they figured the drug company would know what to do about it. That was the first thing they all asked. Well, what does the drug company say?
So this was outside of the doctor's experience. I mean, I've never heard of anything as terrible as this.
Yeah. And there, it's interesting because there were a couple of doctors looking back through my medical notes that knew that this was a neurological complication to a vaccine. So they must have seen this type of reaction previously.
I mean, just listening to what
So
you've said, to me, it's obviously a severe neuronal inflammation that's being described. I mean, that is clinically,
yeah,
that seems
yeah,
fairly obvious. Yeah.
yeah. And
So,
that's
so
really
that
what,
at least your doctors took you seriously to begin with.
well, a couple of them did. Most of them did not. So when I was admitted to the hospital because my legs were noodles and I was incontinent, and the severity to light and sound was so bad that I lost 10 pounds in that first 2.5 weeks. Um, the the neurologist, they gave me a bunch of drugs to try to tamp down a silent migraine, and I was like, okay, let's see if that's what it is. So they drugged me up really good for 3 days, and then of course the medications didn't do anything because that's not what it was. And I remember the lead neurologist came in and she sat down and she looked at me and she said, COVID's a really hard time. And we think you just got really stressed out and then you went out and got this vaccine and you just kind of had a mental breakdown. So, and I have to laugh about it because it's so
This is a
ridiculous. But at
neurologist
the
saying,
time,
and this is a neurologist, a physician.
yes, like one of the best in the state, right? And so they didn't do a spinal tap. They didn't run any, I didn't even get an MRI while I was in the hospital. I got a CBC blood panel and that was it. Like super simple testing.
This is all in
And,
your head.
but
You've just gone a bit nutty, Brianne. It's just unbelievable.
yes, yes. And so the team with all the follow up, they kept saying, well, if you talk to a psychologist, and so they actually convinced me that it was anxiety because I was like, oh, these are the professionals. So I went to a psychiatrist, and the psychiatrist did a neurological eval because he was board certified in neurology. And he said, I don't know what this is, but it's not anxiety. There's something going on in your body. And so he sent them a letter too and said, hey, you guys need to help her. They still wouldn't help me. Um, and then the NIH got involved, and the National Institutes of Health in January 11th, 2021. So if you think back about where you were in January 2021, the world still largely had yet to get a shot,
Yeah.
right? Most people, there were people in the US that were just barely starting to get it. Um, and the NIH was very interested in this reaction. They were very concerned that it was in the clinical trial with AstraZeneca. And they started a study that day, and they tried to work with my home neurologists that kept persisting it was anxiety. And the NIH said she needs IVIG, she needs plasmapheresis, she needs some immunotherapy to stop the cascade of the reaction. And my medical team at home refused. So the NIH took pity on me and flew me out. So I was in Bethesda, Maryland, and at the facility there, and they did the top of the line testing, evaluation, treatments, and I got IVIG there, and I went from bedbound to being able to walk around. And I have the data actually on my Apple Watch. My walking heart rate was being tracked on my Apple Watch, and I didn't know it at the time. And it's interesting because it's nice and low when I was, before I got my shot, and then it shoots up literally the day I get my shot, and it stays high until I go to the NIH, and right when I get IVIG, then it goes back down.
This is the intravenous immunoglobulin that would hopefully damp down
Yeah.
the
And
reaction.
there's not a whole lot of research out there on this, but so they're not sure if it's just expanding the blood volume that's doing it, or if it's actually calming down some type of autoimmune cascade that's triggering these postural, orthostatic type symptoms. Either way, it worked in my case, and there was documented evidence, to show that it was effective.
I mean,
So,
what level of relief did you get from this appalling all over body pain sensation?
so at the beginning, it was a 10 out of 10. And after my first couple of runs with IVIG, it brought it down to about a 6. And so now it's sitting at a steady 4 or 5 right now. So yeah, so it's bad enough that it definitely is something where I still have to have a lot of willpower to mentally to cope with it, be okay with it, okay with it. But to be able to coexist with this situation, so then I can be present for my kids, so I can be present for my husband, for myself too. The worst place for anyone that's injured is when you're trapped inside your own head with nothing to think about but your own painful sensations going on, whether it's the heart rate fluctuations, the tinnitus, the joint pain, nerve pain. That's the worst place to be. So being able to connect with others has been a really wonderful way for me to be able to get out of that situation in my head.
I mean, what you're describing is probably the worst syndrome, either as an adverse reaction or as a medical condition I think I've probably ever heard of. It just sounds, I just can't, I'm really struggling to just, imagine how you're functional. It's just amazing that you can.
It's hard,
Yeah.
there's a lot of people that they've ended their lives because of it. I'm really, 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 really stubborn, and there is no way that I'm going to let the drug companies have more of me than they already have. And so I've done a lot of mental work to be able to figure out how I can compartmentalize. But I will be totally honest, I still have days where this overwhelms me and I need to, go through the cycle of grief and letting those feelings move through my body and my mind. You can't just let it all build up. It's gotta move through you, And so, and that's something that's, things that we can learn from other people that have dealt with complex chronic illnesses for hundreds of years, thousands of years. That is not new. Learning how to cope with chronic pain and extreme discomfort is something that people have been trying to figure out for a very, very, very long time. And right now, this seems to be working for me for the
Yeah.
most part. But it still doesn't mean that I'm happy with the situation or I'm okay with the situation. But it just means that, I'm able to do things with the limited time that I have other than sit in silence and
I mean, so
suffer
to have
by
pain in
myself.
one part of the body is one thing, but you've basically got it all over all the time. This is just, yeah.
Yeah. Yeah. It feels like I'm rolling in cactus all the time. It's just, it's, yeah.
And I'm
So
just so sorry you've had to go through this. It's appalling. It's just,
thanks. I'm not alone. That's the more frustrating part for me because I was in the clinical trial. So there's a part of that where it's like, okay, I signed up to discover what this drug could do. And now I know very, very well what this drug can do. And the drug company does not want to tell anyone what this drug can do. And in subsequent order, now there's thousands, if not tens of thousands of people like me that are dealing with the same thing. And they had no idea. They had no idea this could happen to
and
them.
actually that's the main reason for doing this video, I think, because people that are suffering in isolation will watch this and realize it's not just them. This is a group of people all around the world. People are not suffering in isolation, and I don't know if that helps, but I think a
Yeah.
lot of people certainly say that that they appreciate the fact that they know they're not isolated anymore.
Well, that's a really important point, right? Because chronic pain will rob everything from you, right? It'll rob your
Yeah,
sanity, it'll rob your dignity. Um, but there is a certain comfort, a certain degree of comfort that comes from understanding that there
yeah,
are people out there that get it. And for the people that are like me, totally get it. But then I also have this just profound love for people in my situation, because I understand that most of the time that's the only thing that they can get, right? That will actually be able to, that they are able to receive. And I'm hopeful that every single one of those people has loving, patient, family support. That's probably one of the most important things people can do as caretakers, is to just be there and just be there in love. That's it. Um, it's such a simple thing that we keep forgetting, but there's healing power in that too. There really is.
Absolutely. So the AstraZeneca trial, it consisted of 2 vaccines, I believe, and you only had one. So
Yes. So I got AZT 1222.
right,
I
that was
think
the
there's 3
batch.
twos in there.
Yeah.
Mhm.
So obviously you didn't have the second one. And presumably, as far as you know, what was this adverse reaction included in the end of trial data? Do you know that?
As far as I know, I couldn't find myself in there. So the New England Journal of Medicine published
Yes.
the AstraZeneca clinical trial data. It was released in October time of
Sounds about right,
2021, I
yeah.
believe, maybe September. And there's 2 interesting things there. One is they say they follow all adverse events for 730 days. They stopped tracking my data at day 60. And the other thing is that they say that people dropped out, that people opted out to get, instead of getting the second dose. So basically saying that the clinical trial participants that didn't get the second dose, they're all dropouts. They just, and they're lost to the system. There is nowhere in the report that shows why they dropped out. So there's some really key pieces of information there that's missing, specifically from the AstraZeneca clinical trial report. After meeting other clinical trial participants, namely the kids clinical trial for 12 to 15-year-olds, Maddie DeGarry was injured in that trial. Same thing there. She's coded as a stomach ache in that report. Moderna, Olivia Tessinar, she's a clinical trial participant for the Moderna clinical trial in the United States. The report there shows that she had a minor shoulder upset. She ended up with severe lymphadenopathy, and that's basically where you have, your lymph nodes are the sizes of golf ball or softballs, and they needed to be surgically removed. She now has T-cell lymphoma. These are all things that are a little bit different than what is being shown in these clinical trial reports.
So basically, you're just a dropout, as far as you know.
Yeah, I'm a quitter.